So we'll proceed now for the last case of the day. It's a 42 years old woman, acute cholangitis with jaundice 2 weeks ago, managed with antibiotics, CT scan and MRCP found a 10 millimeter lower CBD stone and a cystic duct stone obstructing the gallbladder. So today the purpose is to go and extract this CBD stone, put maybe plastic stent, so we'll begin now. ما تنجمش تعمل 100 حاجة بيد واحدة راهو، فهمتي أنا. C'est bon ici. So we begin our ERCP. So the first step is to cross the upper esophagus sphincter. We see the T-tube here. So we will push the scope and torque it a little bit to the right, and with gentle movement we are in the upper part. We see the mucosa. We cross it slowly until we reach 35-40 centimeter to be in the stomach. Once at 40, I will torque a little bit my scope to the left right to see the fundus. So this is the fundus here. We will just turn a little bit and push in the same time and turn my scope to the right. Now I see the antrum and the pylorus should be there far away. So I will continue pushing, putting some CO2, and we see clearly the pylorus there. So I won't care about seeing it now. I know it's just facing the scope, which is if I use my big wheel, I can see it now. So I will put my big wheel in neutral position and push slowly, and I am in. So once in the first duodenum, we just torque a little bit the scope and push, and we begin seeing the second part of the delirium. So I will turn my little wheel to the right, lock it, and on fluoroscopy we are in the long scope position, so I will try to pull slowly my tube and try to get in the short scope position, and if I fail, I will push again more to get inside the second part of the delirium, which is here. I will pull back again, and I see the papilla just there facing me now, so I will turn my body to the right. The papilla is at 1 o'clock position, and we see clearly there is two openings. We see, I think the upper one will be the CBD and the lower one the pancreatic duct. So we are in the short scope position. So I see maybe one or two. So now we take our sphincterotomy. We are in a stable position. And I see the two little holes there. One should be the CBD. And we see the direction of our CBD. So if you see the tip of the sphincterotomy, I think this one is the CBD and the lower one is the pancreatic duct. So what I will do, I will just go there and try to go. I think I am in, but we will try to push our wire. And we are in. So it's looping there because we have this. I think we have our stone there. So what I will do, I will just get my position there. I will pull back my wire and try to So it's looping there. It's not an issue. It's not a problem. So we loop it and we are now where we want. So in the CBD. So we'll push our sphincterotomy to get the access inside. So now the step 1 of ERCP, the cannulation is done. This. Stop. So I don't know if I am in the cystic duct or in the CBD. So I will this. I will pull back my sphincterotomy. I have some water, but sure some air there. This is the bile coming. Stop. So I will go now to the middle of the CBD here. I will go maybe further there. I inject here. And sorry, we just have now to check if we are in the cystic duct or the CBD. So we begin injection. I see the contrast there. I will go further there. And it looks like the CBD there. So we see the intrahepatic duct in the upper part. So I will secure my access there. I will pull back slowly. And we are sure in the intrahepatic duct here. Inject it, stop. So now we have to check the lower CBD and see where it is the stone, because until now we have an obstruction in the level of the cystic duct. I don't see still the gallbladder. So I will pull back slowly and contrast injector. And we will put some contrast to see where is our cystic duct. So still here, and I know what's happening now. It's okay, c'est bon. So we see something now. We will switch on fluoroscopic view, and we see it clearly while we were injecting. A stone moved in the upper part, and the stone now, this will get, is hidden behind the scope. So I will go for a long scope position, or maybe turn my scope like this, and you see the stone there. So we'll go in the long scope position like this, and we see this stone which is almost the size of the the scope. So it won't be easy to take it out. We have not dilated lower CBD. We can do a big sphincterotomy. I don't still see my cystic duct. It's not my problem today. So we proceed now for the next step, which is the sphincterotomy. So we secure the wire there, and we are out. C'est bon. So if we think a little bit, should I do a large sphincterotomy or little one? Because in all cases, I don't think we can extract it without dilation. So I will try just first to cut, but so cutting the third of the wire should be inside, and the 2/3 we have to see the 2/3 outside. So I can't cut until maybe more here, but slowly, and we almost have the full cut here. So I will suck all the yellow liquid here, and I want to see my muscle there. So what we can do now, we have still some muscle there, but I don't want to do a full sphincterotomy. So what we will do now, okay, so we'll exchange our guide wire, keeping there, the sphincterotomy with an extraction balloon. If we are lucky, we can get out this stone. And if I want to be sure of my procedure, for the next step, I can choose a dilation CRE balloon and dilate maybe to 12 millimeter. So I think I will go for the extraction balloon first. We try to move that stone. تعمل لي rotation scopie. So if you are able to move it, it's okay. If I feel resistance, I have two still options. I can go for mechanical lithotripsy or balloon dilation, but I have to dilate 4 centimeters of the lower CBD. And now we can see the cystic duct while once we have done a rotation of the fluoroscopy, we see clearly. رجع كيف ما كانت. So we'll come back to normal position. رجعت. And so we see the cystic duct there. We are not in the cystic duct. So I will go now. أرجع لي كما كنت هذه. I will come back to fluoroscopy, turn it to the sagittal plane. So my balloon is there. So I will go in the upper part and I see my stone. So I will inflate until 9 and see if the balloon can, and you see anytime. لا أرجع فيش. So at 9 millimeter diameter, I couldn't catch the stone. So I will go for 12 millimeter and see, but it's the same. The stone is still locked there. به عودة مشيته أنفخها. So I don't think we will be able to extract it now, and it looks like a Biridi syndrome where the stone is stuck at there. So we have two solutions. The easiest one is to put a stent and go out. The other one, so the other one is to dilate. or we can use a basket to crush this stone. اعطيني خلينا نكسروها. دغمية ميسالش شاشة. So we go to the lithotripter, mechanical one. We'll try to catch this stone because really ايه طيب بعد هاد السيستم تاع عطيه المهرة اجا انت. لا لا مهر بس بخاف نحط في القيدة. هاك عندك تو قلت So I will go for easiest, I think the easiest one. I don't want to use the spy scope due to financial problem. Compressor برشتي. So I will use my Olympus mechanical lithotripter. Try to catch this stone. We have the space to catch it. نزلنا في الأقل تنقول لك. So we are there. نهت. طيب هذيك عنده هو. ريتش قلت لك من بكري معناها نتلهاو بحاجه في يدنا كهو شهمنا في الباقي. تو قلت الماهر باش تلهى بها انت هذيك تاخذ فيها وتغزر له علاش تو انت. وسخ لي الطاوله غادي. علاش هكا تلهى في الجيد نتاعك تلهى في الجيد نتاعك. So I will cross. I see the stone there. حله بشويه من هنا تحل تكسرها سيدي تكسر لك. So I opened the basket and we try to see if I can. I feel it. I أبدأ سكر. So we have the stone there. So I will push my after سكر. So we get it here. ركب السيستم هاتي. لا لا ما تجبد يديها اللي باش تخرج لي انت. سيب كل شيء سيب. اقرب لي ماهر اقرب. سيب بون. به So I just catch the stone now. I can try to pull it back and try to see if he can come out. And we see the stone is really so I will just try to crawl to close it slowly. فما حاجة قدوا لي. So the stone is catched. It's in the lower part. لازم هذه يتقدم هنا. So I'm trying to just to ما نجمش نعمل كل شيء يعطيني. So we have just to press here. So هذه ماهيش راكبة بالقدا. لا فما حاجة. هي وصلت لغادي ساي. نقول لك دقيقة. C'est bon, non, c'est bon. So now the system is okay. So I'm closing slowly. ما وصلتش بالكدا ديما هذه مش شادة هكا. Normalement c'est bon. هكا c'est bon. So we see now closing slowly. شد لي مهرة مطلوقة هذيك ودور بشوية. So استنى حتى نقول لك. So I'm now getting my stern. أبدأ سكر دور تراه. And we see on endoscopic view. زيد دور 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 بشوية دور حتى باش نعمل طق. زيد دور بشوية بشوية بشوية. So the stern now is really blocked there. And he become smaller in size. So I can make some movement. زيد زيد شوية. زيد زيد. Parfait. زيد شوية. يبسة. بيحتاج شكون يتقطع الخيط. So I try to catch my stern. I don't know if it's okay. خلي مطلوق خليها. عاود زيد دور زيد دور دور. I think we broken the system. هرجع هكا. اي تنجم تهرب من غادي به. عاود دز حل هذيك. دز القدام الكل. به. خلينا نعاود نجبد انا تالي شوية. So I will try to extract this stone like this and it should come usually. به. اسمع جوست شد ليه سكرت انت بلوكيت. به. So the stone is really out now and we crushed the stone. So what I will do is just try to move my scope and I see the stone coming. Out. And you see it sure can come. حيت يد حات من غادي ترى. لا حليت هكا ترى. ابدا سكت اشوف. ابدا دور دور دور. نعم سي بون نمشي. خلينا نمشي معاك انا شويه. استنى. امشي برا. امشي 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 امشي. هذه خلي مطلوقه. هذه مطلوقه هذيك. عاود ترشقت مره اخرى. زيد ترى زيد 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 زيد. باهي. تو هكا الكاليبر مريقل تفتفتت معناتها. So we crushed the stone now. We see a lot of. So I'm trying to get out with the stone and it's just question of some pressure. لا اغزر. تو قعدنا هذه قاعدة تحل ريت. عاود 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 عاود. عاود نقول لك. لا نحب نخرج مانيش قاعد تخرج تو لازم تشدها لي انت. اجبد اجبد. ما انا قاعد نجبد من الجين قاعدة تخرج لي. معناها هذا تسيب. شدني شدها. هذاك اجبد لي كنت جبته. دقيقة نمشي معاك انا شوية. استنى استنى استنى. اجبدني اجبد شوية اجبد شوية. اقعد هكاك. هذاك لازم تشدوا لي انت شوية خاطر الحجرة باش وحلت ياسر باش تخرج شوية. So what I can do, I can dislodge my شاد انا هذا. And I will just, and it's done. We see the stone, we have crushed the stone, it's out. C'est parfait. So I will come back with my basket. And it's okay. C'est bon, c'est bon, c'est bon. So now we have just to حل شوية نهاية خلينا نضيفوها ترى. C'est bon. So stone crushed. So I don't worry about my guide wire. In all case we have cleaned. So I have to get out with my ما تخليش يخرج هذاك. لا كان فما حجر مش جبت الكل انت سي بون. So the crush little crush is out. So now we will go with the balloon. شد لا ما تنحيش من يدك نحي شد deux extrémités جبت في الجيبات. So we'll go now for the next step will be to be sure that everything is clean. هذاك عطيه المهرة. So we will use the 12 millimeter extraction balloon. And we see the bile coming here. So I think it was like a Mirizzi syndrome. The stent was the stone was locked in the common hepatic duct. أبدأ فيقة. And we see the little stone there, fragmentation of the big one. أنا واحد في آخر الكبدة راني توا. اغزر لي اغزر يعني ما عادش تكسر هكا اجبدوا هكا ما عادش تكسر مانك ما عادش تكسر كله معوج ولا لك غادي شوف كيش معوج. انفخي انفخ كله. So we are in the upper part at 12 millimeters. So we are pulling back our extraction balloon and we see what is coming. This is the stone we just crushed and I am in the lower part and I will see my balloon coming. شوية. There's a little stone there. We'll just with some movement left right and we should get it out. The balloon, I see my balloon now. شوية هنا. And this stone is out. So this is what was blocked. So I will go again in the upper part now. Okay. So we can stop until we see everything's clean because I have some fragment coming. So what we can do now is just wash with saline to get out all this little piece of the stone and you see them coming. So I will leave my balloon, extraction balloon here. I will put some water and you will see what will happen now. So I put it in the middle of the CBD there and you see all that little stone coming. We put some pressure. Of course, we can do a balloon dilation of the lower CBD and the sphincter, but I don't think we'll need it. So water, and you see how it's large enough to extract stone. So I will go again in the upper part. في الجدة. Après. And still some start coming. And you see how with the water we can easily pull out our balloon, which is here. نفط تحطوا كليماتيزور شوية بربي. So we go again. Enfin. دوس في الجيم نتاعك. My balloon is just here. It's 12 millimeter. فش. So you see this little stone coming here, and it just will go out now. Just out now. My balloon is almost out. فشوية. أغسله. So I will put some water. And you see how little stone is coming. C'est bon. On va maintenant. On ferait. And we see how no stone are coming now. We are at the lower part. 9, 9, 9. So little stone is just there. So I have to cross and get it out. انفخ هاي نافة. انفخ لي نافة. ما تفوتليش النافة مالك. يزك ها. فش. انفخ نافة. انفخ 12. So the balloon is almost out. 12 نزلت انت. And I just want to get my balloon out. فش نافة. And this is the last part of the stone coming out. Another one here. And we think we are done now, but we will of course fish. اغسل. I will put saline to clean the all little stone there. And we think we are almost done here, so feel it. Enfin. So we see only clear bile coming. I don't see any stone coming. And the balloon went, even 12 millimeter went out easily. So we will go for a last cleaning. خبي في القطة. يعني هاد بربي ما عادش تعوج هكاك، راك تعمل له هكا هي ما يتكسر، راهو سي يتكسر لك راهو هذاك. جبت القد جبت. نمشي نمشي بقى. نوفخ. دوز دوز. So I'm in 12 millimeter balloon, so I will go if, and you see the balloon coming slowly, and I think we are done. I pull contrast. So all the crushed part of the sun outside. So the last step will be the occlusion cholangiogram. نفخه نفخ كله برانجكتي. So we'll begin our cholangiogram. We see now the posterior right hepatic duct. We begin to see the anterior one there. I'm pulling back slowly. Everything is clean. And now I will go for the lower CBD. And we see the stone on this. نفس الكالكول في السيستيكا. تعمل لي روتاسيون بربي خلينا نشوفوا خيرة. امشي لغادي امشي. زيد 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 زيد. به زيد. Parfait. Stop هكاكا. به stop 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 stop. So we see the stone in the cystic duct there. I think there is no obstruction of the cystic duct. Stop. خبي في القيد خبي ترى. So on MRCP they talk about stone in the امشي in the cystic duct. جمت فش برا مسلش. امشي برا امشي لا تفش تفش امشي امشي. ارجع شوية. امشي للسيستيك تحب امشي السيستيك لا ارجع اقعد هكاك. فش البالون. امشي ترى بشوية امشي. امشي ارجع امشي اقعد هكاك اقعد. So to access the cystic duct we need to be able to orientate our guide. امشي بشوية ترى هنا. And you see how it's looping there and it will be in the CBD. أعطيني سفنكتيراتور. ولا الكانيول ولا هات السفنكتيراتور. حضر لي بروتيز بلاستيك 10 فرانش كان عندك 10 سنتي. ايش عندك؟ 7 شوية. So my question is now, I will try to access the cystic duct, and in all case, I will try to put, in all case, we will put a stent in the CBD. We have the same as Miri syndrome because the stone was locked in the lower common hepatic duct. امشي 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 ارجع امشي ارجع امشي امشي شوي امشي امشي. ناهد براس امك امشي قلت لك امشي تو ترى في دخل في السيستيك. اقعد هكاك. جبد شويه نطلع معاك جبد. امشي ترى، امشي ترى برا، امشي امشي امشي. So we are in the cystic duct. Ouais, contraste. Injector. So I see this stone there, but I want to check if there's another stone there. ده كله هو يمشي غادي. Stop, 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 stop. Injector. So I think the stone there. I don't think I see what this figure is. So I will leave my wire there, try to extract the little stone blocking the cystic duct. And of course we can put for this acute ريت كيف تطلق يولي اسهل لك. اعطيني بالون ديكستراكسيون. So we'll go now to the gallbladder. I see a big stone. It's not my problem, but there's two stone locking there. So I have two choices: pushing them inside or getting them out. اغزر لي اغزر لي غادي فما خيط ظاهر غادي ما تزوجش يتحرك الخيط هذاك. So I'm here. So now on fluoroscopy we have to be the same speed, and I will turn here inside my and try to انفخ لي نافه. And I see a big stone there. So this is not my problem. This will interact. I don't think I will see something coming. This will get this. So nothing is coming. If you get interact, so I will push the big stone now inside. And you see the big stone is there. انفخه. نافه. اجبد في الجيت خلينا نقدم شويه انت. And with the big wheel I'm pushing and اجبد في الجيت اجبد. نفخت اكثر منه. فش شوي فش. C'est bon. And we see it's really free here. So we push the stone in all the gallbladder, and we see the dilated cystic duct just there. فش ولا خلي. So انفخ نافه. So the balloon is inside the gallbladder, this. So I will go out now with my extraction balloon. I have no obstruction on my cystic duct. So what last step should I put a CBD stent for the Miri-D syndrome? The surgeon asked for that. So I will get out. اعطيني اجبد في اليد اجبد. امشي امشي. نحب نمشي لواحد الجهة الأخرى. خبيتره نمشي نمشي خبي نمشي خبيتره نمشي زيد نمشي ناخد هكاك مسيرش. So I have to put my stand here. We see the marker of the extraction balloon. This, and I will push it, pull it back. So I will need at least 10 centimeter. اعطيني ايش عندك كنت يدوزو عندنا جديد في كله. هاي تدوز ايش بدي ازاي. So we will put our 10 French 12 centimeter, which is the large long one for safety. Everything is clean. The cystic duct is not blocked now. The CBD is clean, but we have a Miridi syndrome. So I think jaundice will disappear after 3 or 4 days. أبدأ فايقة. So the next and last step will be pushing that stent in the left hepatic duct. So we have no obstruction, we have no problem, so it will go straight directly there. We have no bleeding. The sphincterotomy, we see the limit of the muscle at 1 o'clock position. So no perforation, no bleeding. The pusher go in. The stent is coming. And we see the distal part of the pusher in the intrahepatic duct. So I will change direction of my scope to be just below the papilla, and I see it clearly here. The stent is going. We see the first marker we put in the half of the stent. The stent is almost in place. So I will continue. And this is the second marker. So I'm pretty good with that. I will push it. اجبد السيستم شوي اجبد. I will pull back the pusher here. And you see how the stent اقعد هكاك. I will push it slowly. This is my distal part of the stent. اجبده. مش كل شيء في الجيد معاه اجبده. So little pressure and my stent is in place. مبردة. So we'll wash with some cold water. And I think she's in the hospital since 2 weeks with this jaundice. I think she will be discharged maybe tomorrow or after tomorrow. Take some rest at home and come back for the laparoscopic cholecystectomy after 2 weeks or maybe 1 month until this jaundice disappear. The stent can be removed before or maybe even the same day or after the cholecystectomy. So we see the vessel there, there's no bleeding. Stent is in place. C'est bon. So we see all the little fragment of the stone here. So now we exfoliate all the water and the air in the stomach. The stone, the big stone get out, crushed, and it's in the stomach. هاي تفيق وترجع للسبيطار.